Hello and welcome. This is Selena Hickman, and I am the Director of Healthcare Operations, Compliance, and Improvement for the Agency of Human Services in the Secretary's Office. I'm here to talk to you today about building an integrated health system, focusing on delivery system reform investments, but starting out with a little bit more description around our Vermont All-Payer Accountable Care Organization model, Medicaid pathway, before segueing into the investments. And I'm joined by two colleagues as well, and I'll have them go ahead and introduce themselves.
My name is Michael Costa. I serve as Deputy Director of Healthcare Reform for the Agency of Administration, one of the lead staff in negotiating the state's all-payer model agreement, and I serve as a technical advisor to the Agency of Human Services.
And my name is Georgia Harris. I'm also a Deputy Director at the Agency of Administration and serve as our SIM Project Director.
So I'll hand it over to Michael to kick us off on the presentation today.
So today's webinar covers the same material that was covered in an in-person meeting on December 8th. It's there as a resource for people who could not attend the meeting or would like to go over the concepts again. We'll really cover 5 items today. 1 are the objectives for this presentation. 2 is the background of how we got here, particularly the federal agreements that brought us here. 3, we'll discuss the Medicaid pathway, which is how we integrate certain services into an integrated healthcare system that's based on provider-led reform. 4, a delivery system reform investment. And 5, we offer up some resource slides. At the end of this presentation, we will also talk a little bit more specifically about the delivery system reform investment application. There are really 3 objectives today. Number 1, we want to develop a common level of understanding around goals. There is a lot of innovation going on in healthcare in Vermont, and we want to make sure we're absolutely on the same page about what our goals are and what our objectives are. Objective number 2 is set initial expectations regarding process. This webinar covers the delivery system reform investment application. We want to make sure that people have appropriate expectations about the process of applying and the process of decision making. And number 3, we just want to explain the delivery system reform investment process that I just said, so people understand the goals and where we're going. So let's take a step back and talk about healthcare reform in Vermont. The big goal is an integrated healthcare system able to achieve the triple aim. The triple aim is in the top right-hand corner of the slide. There are 2 vehicles for achieving that integration across the healthcare system. The first is the Vermont All-Payer Model Agreement, which is a contract between Vermont and CMS to enable ACO-based reform between now and 2022. The Center for Medicare and Medicaid Services provides Vermont with payment flexibility and local control to create a healthcare system specifically customized to the state of Vermont. In exchange, they'd like a few things. Number 1, we need to meet strict quality targets, but this is really improving the health of Vermonters. 2, we need to meet certain financial targets, including a total cost of care cap on certain healthcare expenditures. And 3, we need to meet scale targets, which means we need to have a critical mass of Vermonters inside the model and attributed to it. Also, we have to guarantee that we're going to have some alignment across payers. And by payers, we mean Medicare, Medicaid, and commercial insurers. The all-payer model agreement sets forth planning milestones for future integration, which really serve as the homework for the Agency of Human Services, the Green Mountain Care Board, and Vermont's provider community. Also, we have the Global Commitment Medicaid Waiver. Vermont has had a Global Commitment to Health Medicaid Waiver for some time. It has recently been renewed from 2017 to 2021. It's Vermont's contract with the federal government for how Medicaid will be administered. It allows Medicaid to participate in the all-payer model and pursue delivery system reform by enabling Medicaid to pay in a different way and to allow that method of payment to align with Medicare and commercial insurers. And then finally, the Global Commitment Medicaid Waiver provides the ability for the state to have delivery system reform investments to fund future innovation that will help Vermont integrate and succeed with the all-payer model agreement. These investments are basically allowing the state of Vermont to pay for different things that normally wouldn't be covered by Medicaid, so that we can create an infrastructure and delivery system reform effort that's up to the challenges facing the state of Vermont and is put forth in these agreements. So when we talk about creating an integrated health system, what do we mean? What we're really talking about is the strategic choice by the administration and the Green Mountain Care Board to move away from fee-for-service payment. Vermont is not alone in this goal. Payment reform is moving away from fee-for-service nationally. Both the federal government and many state governments and private insurers are also trying to find the best way to improve healthcare quality outcomes while bending the cost curve. And so we see this in several ways. Congress passed a law several years ago called MACRA, which starts in 2017, and it requires providers to become accountable for the quality of the health of the people they serve. And so this can be done in lots of ways, many of which have been tested through the SIM grant process, where we're saying, okay, how can we pay in a different way to get the results we want? The all-payer model is just another attempt to integrate health system by moving away from fee-for-service. And we're together with other states and the federal government and commercial insurers in doing that. The key question is, though, how do you implement that payment reform? So a little more here. There are really two agreements, as we said before, that allow Vermont to take a one-model approach to payment reform and integration. They're the All-Payer Model Agreement and the Global Commitment Waiver, which are complementary reforms. ACOs are the vehicle for the All-Payer Model financial services, which are basically Medicare Part A and B services and their commercial and Medicaid equivalents, to engage in payment delivery system reform. The APM agreement sets forth the structure, and the GC waiver allows Medicaid to innovate. Medicaid, this doesn't, of course, cover every service that Medicaid offers, though it is the majority of what Medicare and commercial insurers pay for. So we have a separate process that asks the question of how do we truly create an integrated healthcare system across all providers? And the Medicaid pathway is an agency of human services process to create and test ideas for how payment and delivery system reform might further integrate the entire continuum of care. Medicaid pathway is designed to test payment reforms where these services could be paid by the state, an ACO, or both. And federal funding is available to further these efforts described above. So a few more pieces of information to set expectations regarding the process. We deeply appreciate the fact that our stakeholders have been willing to engage with us, the state of Vermont, for the last year and more on the all-payer model, waiver negotiations, the Global Commitment Waiver renewal, and through the SIM grant process and the Medicaid pathway. But we hear loud and clear that stakeholders want a more transparent and collaborative process. So we're committed to providing better communication between government entities and between government entities and stakeholders. So conversations like the one we've been having every other week on Medicaid pathway, or meetings like the one we had regarding this effort on December 8th are going to be part of our ongoing strategy to make sure that everybody's on the same page. And that's important because we have multiple ongoing processes. There's the Medicaid pathway, these delivery system reform investment applications. The state budget development needs to reflect healthcare policy priorities. And the legislature empowered the Green Mountain Care Board to regulate ACOs starting in 2017 and 2018. So I'm going to hand it now to my colleague Selena Hickman to talk a little bit more about the Medicaid pathway, and then we'll discuss the delivery system reform investment application.
Okay, thank you so much, Michael. So as we talk about the Medicaid pathway, we're looking more specifically as Medicaid as a payer in the all-payer model. And we're talking about services that are not initially included in the total cost of care for Vermont's all-payer model. So the Medicaid pathway is a process that is meant to advance payment and delivery system reform for these services. The ultimate goal, of course, is alignment of payment and delivery system principles through both the all-payer model and Medicaid pathway, looking at that ultimate goal from a prior slide of that more integrated system of care for all Vermonters. So in the Medicaid pathway process, we already have a few cohorts of individuals who have been meeting over the calendar year of 2016. Cohort 1 has been looking at services provided by designated and specialized service agencies, whereas the second cohort has been looking at services provided by long-term services and supports providers focused in on the Choices for Care program. So when we talk about Medicaid pathway as a process, there are critical steps included in that process. We can't underscore enough the alignment of the reforms with the all-payer model, in particular the timeline, as well as delivery system expectations, quality measures, and monitoring activities that would be aligned with all-payer model requirements. We're also looking at alignment in some other areas, such as the new substance use disorder treatment waiver, which Vermont intends to submit in calendar year 2017. And then we're also focusing on expansion of successful components of existing models, things like integrating family services, where we've taken an integrated approach towards services which were traditionally fragmented, both in payment and in delivery. So the final piece here in terms of critical steps is that we're encouraging reform through as many services as feasible in the first two cohorts, really looking at population-based approaches. So now let's segue into delivery system reform investments. So I'm going to start with some high-level information here in these slides, and then we're going to pivot to the actual application packet for a little bit more detail. So first of all, we want to be clear about who can apply by the terms of the federal agreement. There are two categories of application. Category 1 is meant for ACOs. If you are an ACO, you may apply under Category 1. If you are not, then you should be looking at Category 2 for Medicaid community providers. In these applications, we are looking for some specific things, and this information is repeated in more detail in the investment packet. We are looking at investment proposals, particularly that promote collaboration, build capacity, and consider social determinants of health, this promotion of an integrated healthcare system, really with consistency with the Vermont All-Payer Model Agreement and the Global Commitment Waiver. So you've probably noticed by now that we are underscoring in similar words multiple times these ideas of alignment, consistency, integration. Please take those to heart and reflect those back to us in your applications. The state and CMS are encouraging ACO-based provider-led reform, and that's also critical to underscore that in the all-payer model, we are testing an ACO-based delivery, and even in the Medicaid pathway and community-based provider reform, we are enabling people to move towards those more integrated delivery models, that ACO delivery model. So this would feature collaboration between providers, payment models that move away from fee-for-service, and a rigorous quality measurement that aligns with the all-payer model quality framework. So I'll mention it here and then I'll mention it later. We're going to provide a couple of links to websites, including where the all-payer model agreement itself is housed online, as well as the global commitment waiver, and then we also have a goals document related to the Medicaid pathway, which will be some nice collateral for you as you're looking at putting your investments together. So you're putting an investment application together. The first round of applications are due by January 15th of 2017. This is not the only bite at the apple, however, it is the first opportunity, and that is the deadline for the first opportunity. The state will have a robust review process. We have to review from a couple of different perspectives. We have to review the technical components of the application to make sure that they actually comply with federal requirements. We are also looking across the Agency of Human Services at our existing programming across departments to make sure, and receiving recommendations to make sure that the investments do not go contrary or duplicate services and funding that is already available. But finally, this is a determination of the Agency of Human Services Secretary. So timing, the funds will be released based on the availability of state matching funds, receipt of federal approval, and execution of an agreement. We do expect that the first round of applications will be able to be implemented by July 1st of 2017, and it could go faster depending on the sufficiency of the application and the timeline of our federal partners in response. So next steps, we've included a link here to an email on this page. You can send questions to the AHS Medicaid Policy email box, and we will respond to you. That box is checked daily. We have this webinar, of course, today on how to apply. And then we do have some other information that's going to be out there for you to keep a lookout for. The Medicaid Pathway Report to the Legislature required by Act 113 will be posted prior to the end of this application period, so that would be some interesting material for you to read as well to see where we are on that project. So at this point, I think what we're going to do is we're going to move to the application itself, and we're just going to go in a little bit more detail on some of these sections. I'm going to go through the first part of the application, and then I'll turn it over to Georgia to go through the appendices. So the background I'm not going to spend much time on because we really actually in our slides talked quite a bit about the objective and the goals overall of these investments and where we're trying to go. When we're talking about what the grants will fund, these are really governed by the appendices B and C. Appendix B talks about our goals for the investments, and Georgia will go into that in a little bit more detail. Appendix C actually details what our federal partners would deem as unallowable for investment, so that's also of critical importance. Moving to page 2 of the application, I did want to highlight for you the criteria for review and evaluation of these investments. This is something that you will want to pay particular attention to as you're submitting your proposals. So as I just noted, compliance with CMS funding categories, that is not something that we can be flexible on because it is not a state level requirement. Additionally, we will be very interested to see your use of data, evidence of use of data to support the need that you are proposing to meet in your application. As I stated several times and others as well, action to integrate services across the continuum of health and wellness, getting at that primary goal of all of our health delivery reform. We're also interested in your effort to build on existing innovative practices that show evidence of success. So if there's something you started, you have evidence, show us the data, show us how these short-term funds can really help you get that one step further. Additionally, looking at linkage to statewide health outcomes and quality, this is where looking at the all-payer model agreement and that link which we will provide will be helpful to you because those quality measures are listed there. Feasibility is an important component in our evaluation. You may have a great project, but if it's not actually able to be implemented with the resources and the timeline and the budgets that are provided, it will not be able to move forward. And then finally, evidence of the use of the Vermont model of care. This is something which I think we should also provide a link to, and we'll do that just to make sure that you are well aware of the each of the elements of the Vermont model of care that we're seeking to have you support in some way through applications. So timing of applications, I already told you at a high level, they're due by January 15th, and we're going to try to get these implemented no later than July 1st. That is the first round of applications. There will be additional opportunities to apply after this first opportunity, but that if you want to be in the first cohort of implementers, that is your due date for submission. We provided some more detail in this section as to how long it will take us to perform other activities related to the application. Additionally, the application requirements, I want to highlight for you that the appendices are where the meat of the application requirements are. That's where you're seeing all of the detail, the template that you need to fill in order to be successful. And lastly, before I hand it over to Georgia, compliance and reporting requirements. So depending on the type of investment that this is, there will be varied compliance and or reporting requirements associated with them. So we have not detailed all of the possible iterations here in this section, but we do not want you to leave thinking that there will be no compliance or reporting requirements. These will be provided to successful applicants, and there will be discussion around what is entailed. In the second paragraph, it can be summed up by saying that costs must be supported by adequate source documentation. So as you're thinking about your proposal, you should also, along the way, be thinking about how you would actually document that the activities were performed and provided as intended. I'm going to hand it over now to Georgia to walk you through the rest.
Thank you so much, Selena. In Appendix A, which is a sample format for the application, we are encouraging all applicants to use a standardized format to ensure that you include all of the components to meet the technical review for your application. We are asking that your project information, which can be considered a project narrative, really be limited to 10 pages. We ask that within that section of project information or project narrative, you include information regarding your project, which will include a project plan. A Gantt chart would be sufficient to fulfill that component, as well as including information about how you would measure the outcomes of your project, the return on the investment, what the impact is to Vermonters and to providers, and then please include some information regarding how you will evaluate your project. Additionally, moving on to the next page of the appendix, if you could please include information regarding the specific populations that you are serving through your application, as well as a budget summary. The budget summary includes specific categories of funding that are included in the latter portion of this appendix, and we're just asking that you roll it up into a summary portion in addition to the detail. Moving down to the next page, we are asking that you provide specific detail regarding salary and wages. As you can see, there's a description there with an example. We also need you to justify every position that you would be requiring and include a job description for those individuals. Ideally, if you have those individuals' names, you would include that as well. We're asking that you include the fringe benefit information as applicable. And again, please provide the detail regarding all fringe benefits. Moving down to any consultant costs, the application requires that you include, on page 7, thank you. The application requires that you include a lot of specific information about consultants. So in addition to the name of the consultant or an appropriate organizational affiliation, we need the nature of the services, and the nature of the services would be similar to a scope of work that you would use to engage this consultant. We need to know how long the consultant would be working for you and the expected rate of compensation. Particularly, if you could be sure to call out any travel costs and specificity around estimated travel, if there would be per diem costs. And then we would need to know if this is deliverables-based payments or time and materials-based budgeting, etc. Additionally, you are allowed to propose equipment costs, and again, please provide detail around what the equipment is, with specificity, the number, and the cost for that equipment. You can also request funding for supplies, and again, we provided an example for how you could potentially budget for supplies, and for both the supplies and the equipment, we would need a justification. Moving on to the other category, this is for things that don't quite fit in there. One of the areas is, printing costs or postage, et cetera, general office things. Please include those in that area. If you are requesting indirect costs, please provide the calculation for how you would request those indirect costs. As Selena indicated, these are federal funds, and we do need to comply with the Uniform Federal Guidance. That means that the default is a 10% de minimis indirect rate, according to the Uniform Federal Guidance. If you have a different approved rate with either the state of Vermont or with an appropriate federal agency, please provide the documentation of that alternate indirect rate with your application. Moving on to Appendix B. Appendix B includes the funding categories, and these funding categories are described earlier in the application, and there's two broad categories. So the first category really applies to accountable care organization infrastructure improvement. And as you can see in the detail, there are some specific objectives and potential requirements in here. And I would note that these are listed in several categories, items 1A through items 1B, 1 through 4. And it covers a cross-section of different activities that could be performed. Moving down to the bottom of page 12, which is category 2. This is for Medicaid the Medicaid Community Provider Integration Program, known as the Medicaid Pathway up here in Vermont. And again, the eligibility and objective for this is noted in this appendix. Moving on to Appendix C, as Selena indicated, there are some areas where federal funds cannot be used. These are listed here. I would highlight just a couple of them of interest, and you'll see that they relate to standard categories that Medicaid does not fund in any state. Additionally, I would note that depending on the potential federal funding source, there could be other categories that may or may not be allowable, such as food or conference space or training. To the extent that you are requesting that as part of your budget, please note that should those issues come up, we would work with you during the normal contracting process to figure out how to deal with things that are unallowable. Finally, moving on to Appendix D. This is a flow chart that goes over the review process that we have described verbally during this webinar. And the hope is that it provides an example of how applications could go through. I would say that it may not be exactly as flowy as is indicated here, but the intent is the same, to say that there's a universal intake process, there's a technical review, then there's a leadership review. And during all of the technical review and leadership process, there is that identification of what type of federal funding source would be utilized to make sure that we receive the appropriate federal approvals. And with that, I will turn it back to Selena.
All right, well, thank you so much. I think that we have successfully completed the content that we wanted to review with you today. I will just note, if you are left hanging with still more questions, to refer back to that email address noted on slide 16 of the initial PowerPoint presentation that we provided, ahs.medicaidpolicy@vermont.gov. We'll make sure that your inquiry gets to the right person to address the question. Thank you so much.